The data was divided into those that had all the doses and those that had just recommended phase 2 dose. So we're just focusing on the recommended phase 2 dose, the 75 million CAR T cells. So it was really well tolerated. So in terms of the most common treatment emergent AEs or adverse events, cytopenias like neutropenia, as well as CRS or cytokine release syndrome were the most common AEs. In terms of the grade 3 or 4 events, so higher events, CRS in the recommended phase 2 dose group, there was no grade 3 or 4 CRS events. And in terms of infections, there was only one case of grade 3 or 4 infection event in the recommended phase 2 dose group. So it's really well tolerated. Overall, only 7 patients or 28% of the recommended phase 2 dose group reported a serious treatment emergent AE. And there were 6 deaths on the study out of 51 patients altogether. All 6 deaths were due to disease progression, none of which were due to the therapy delivered. Again, the data is presented for all the patients as well as the recommended phase 2 dose. So just focusing on the recommended phase 2 dose, if we look at patients that had only one prior line of therapy, so those that are older and not transplant eligible, their overall response rate was 100% and their complete remission rate was 80%. In patients that had 2 or more prior lines of therapy, the overall response rate was still above 90%, with a CR rate around about 75%. So yeah, we can see that in the recommended phase 2 dose group, irrespective of how many lines the patients have had, the response rate is very high, especially the CR rate. So it's very encouraging so far.